Hello, we're going to resume the session. I'm Joan Carles Marc, and I will be the chair for this roundtable. The members in the panel are the ones that have to tell us interesting things about the topic. Please speak slowly so that the translators may carry out the job. I would also ask you to be brief, because we don't have that much time and we have to respect the slots that we have to speak, so that we can have an exchange of views and ideas later. It doesn't make any sense to have a general introduction, so each speaker is going to tell us about specific elements or topics. There's not a common topic. We're speaking about active aging within the framework of working centers, and this is the aspect that links the six interventions. So I'm going to introduce each speaker in the panel, and I would also ask you to be brief again, so that we can close the session at the adequate time. So as I said, we're going to follow the order of interventions that is registered in the agenda, with a slight variation, and this is that the colleague working in the San Miguel group will take part at the end of the presentation, because he's the only one who's going to use our PowerPoint. So we will start without any further ado, and José Carlos López Rodríguez would be the one speaking first from this Confederation of Andalusian Entrepreneurs. Thank you. First of all, I want to thank for the invitation to participate in this seminar, which are going to be very interesting. The entrepreneurial sector has a link with the health of citizens in a twofold manner. As a health service provider, first of all, and privately as well. It is also a working place where citizens spend a certain degree of the time, and as a generator of goods and services that quite frequently are related with the health of citizens. Service provision of healthcare, pharmaceutical industry, machinery and equipment for hospitals, etc. The Grenadine Confederation of Entrepreneurs is very much concerned about the health topics as the top part of the pyramid. We are associated with this topic in various manners. I have some examples here: the Andalusian Association of Private Practices, the Association of Ambulance Entrepreneurs, Association of Andalusian Companies on Technology, on Nuclear Medicine, etc. There are several examples of this kind that I could give you. In this regard, the company may be the perfect place to develop programs to promote health in the workplace. Citizens that have a job spend plenty of time in these environments, and therefore it is a good place to check the new elements and techniques. We have representatives from grenadine companies such as Cerveza Alhambra, the brewing company. So they start health promotion programs. There's no obligation yet to do that, but some companies are doing it within a sustainable policy that they're applying. So that's why in the Confederation what we intend to do is to cooperate in a general line with our associations through information, open doors meetings, where we can exchange views with the persons in charge of companies, with responsible persons that are representatives from the human resources department of companies, etc. This is to the benefit of everyone, both companies and workers themselves. So we are willing and delighted to work with the authorities, or public health authorities, to carry out open doors days or activities directed towards these aspects. It is easier to carry out health promotion in big companies, obviously, than in SMEs. The productive fabric in Granada, as our colleague said earlier, most of the companies are not as big as Cervezas Alhambra, the brewing company that we have here today. Most of the companies are SMEs. And it is not so easy to carry out these programs because they have 4 or 5 employees in a small space, and it's not so obvious or not so easy to implement these measures and these initiatives. There are companies such as Abbott Laboratories, the University of Granada itself, or Cervezas Alhambra, or Puleva dairy products, etc. These are more prone to doing that. Organizational measures can be carried out and implemented, or any other type of measures. For instance, the acknowledgement of the workplace, the time shift, carrying out physical exercise before you actually start to work. Things like that are also interesting, fostering public health initiatives and promotion. Also, the labor and the workplace relations are important amongst the various workers themselves, having a space to carry out physical activity in the workplace, or having time to enjoy some leisure time or activity time with the colleagues, etc., carrying out a healthy diet if they do eat inside the company, etc. And we also have, of course, individual measures such as funding or fostering physical activity, some kind of sport or physical activity. For instance, when the medical tests that are carried out once a year, we can foster an individual plan to foster health and wealthy and healthy habits, healthy lifestyles. There is a cost involved, of course, but in the Confederation we believe that we see this as a profitable aspect. Investing money in the improvement of the situation of the workers is always always has a consequence which is positive for them. So it's good for the company as well. And we have been working in health promotion programs that are saving money in euros. In 3 to 5 euros are saved by each euro that we invest in this program. So it does pay, it is profitable. So it is an important percentage of profit that we get from the investment. We also reduce the health costs in general, of course, by promoting health. It improves the atmosphere in the workplace. It enhances the performance of talent for workers in the company. Knowledge transfer is better, especially between different generations of workers. And it improves the corporate image of the company and of the workers themselves working for the company. So companies taking part in CSR, corporate social responsibility programs, are getting a benefit out of it. We may also promote health in the workplace by collective bargaining, incorporating in collective bargaining processes public health promotion elements that will be obviously a positive measure in this regard. Also, vocational training is a good way by creating and establishing training courses that are aimed at this issue. Is another option. Well, basically that's all I would like to say. As I said earlier, we have a representative from a big company in Granada that can tell us good examples about best practices in this regard. And I will leave the floor to my colleagues, because my colleague from Cervezas Alhambra may tell you in more detail what can be done. There will be room for discussion later. Thank you. Thank you, José Carlos, for your comments and for being concerned with the time that you had at your disposal. And now we can say that we have had several views. The voice of the entrepreneurs has been heard, and now we're going to hear the voice of the representatives of the workers. We have Felix Alonso Gil from Comisiones Obreras, which is one of the main trade unions in Spain. Thank you all. Thank you, Inmaculada, for the invitation to take part in this conference. I am a trade union representative, but I also work in the public health sector as a public health worker, and so far we've heard an optimistic view of the situation, and I regret to give you a pessimistic, realistic view of the situation at the moment. We start from the premise that work as such is a risk for health. The health in the workplace, the conditions, the manipulation of substances that sometimes are toxic, interpersonal relations, etc. All this is conditioning the evolution of the health of the personnel, of the staff. This particular risk for the health of the workers can be palliated by, at least in part, by the legislation that was published in 1995 with the law on prevention of labor or workplace risks, which establishes a series of patterns to control and monitor the situation that could end up producing disorders in the health of the workers. Patterns on use of loads of toxic substances, etc., are established in this regard, and of course the risk and prevention of accidents in the workplace. The survey on workplace health or labor health in 2011, carried out by the administration, shows clearly the positive evolution thanks to the application of the legislation that I have just mentioned. The negative impact of work in the health of workers was established, but then prevention proved to be positive. And when we started the world crisis, however, sadly, there's a shift and policies change, and we are faced with a situation now in which there are a series of negative effects that are going to have an influence in the fact that we reach the end of our working life in the old age, when we have working conditions that are not the ones that we achieved in the prime of the welfare state, with the evolution of the working conditions that we used to have, that were improved from the previous century, from the 19th century and all through the 20th century. And there's a drawback, there's a movement backwards in this regard. The enormous percentage of unemployment in Spain also has an influence in this, in particular in the current situation in Spain. Unemployment is 6 million, the figure is 6 million unemployed people in Spain. This is amazing, and the best thing we could do is to start, it would be best to give public health to 6 million retired people than 6 million unemployed people. So this is obvious. The evolution of this sector is towards the service sector, with a higher presence of SMEs, much more than the one that we used to have. employment is being transformed in a scarce, low qualification, temporary type of employment, and high qualification also has great difficulties in being incorporated to the to the labor market. Salaries are going down and have gone down dramatically, and this also has a negative impact because the citizens, workers, have a lower purchasing power. And this is also, of course, transferred into the state of health of these people. So in the long run, we end up having problems with the legislation on pensions and retirement. So we will have a very much aged population in the labor market. The retirement age has been increased in Spain, and we're going to end up having very old workers, and they are going to be working for the unemployed young people that cannot have access to the market, and they have a better potential to produce. This is terrible. Besides, the policies on labor, the reforms of the labor market have created a further problem, which is finishing with collective bargaining. There is no such collective bargaining now with the situation we have in the government in Spain. So the working class cannot have any impact or modification on the conditions of the labor market. These labor market reforms implemented by the government also endanger some elements. There's a punishment when you become ill, so as you know, it is penalized because the salary is reduced during the time that you are not working. If these problems are repetitive, you may be exposed to being fired. So this could be a reverse trend, in the sense that it becomes a source of disease, the fact that you don't take your leave when you need it, when you're feeling bad. In this situation, sometimes we're speaking about the fact that we have to suffer your disease at home and go to work with no disease. But it is completely the opposite. We end up becoming ill in our workplace because we work in very harsh conditions. Our situation now is terrible in as much as the purchasing power. We have lost a lot of purchasing power, and this is obviously a cost in health, not only because of the working conditions themselves. Purchasing power in the end leads to a big part of the population losing healthy habits because they don't have access to healthy habits that are more expensive. For instance, food has to be cheaper and therefore not so good and not so healthy. And this is even worse in the case of the elderly. I would like to mention that we are trying to introduce the topic of pensions, of pension funds, where there is a sustainability coefficient which is based on life expectancy. I'm wondering now if the social and economic labor conditions that we have at the moment in Spain, maybe not now, but in a few years' time, we might be speaking about life expectancy, which is not maybe not decreasing, but stagnated. A few months ago, I was here for a conference, and we were speaking about austerity policies and the cuts that are taking place in the public health arena in the EU are obviously going to have an influence, and this could be one of them. We will be going backwards in as much as life expectancy because of the cuts in labor rights and in working rights. I am sorry, I'm not optimistic. Thank you very much. Thank you, Felix. And now we change again, and we're going to hear are representative from organizations of people that have disabilities. From the ONCE Association, Juan Cristóbal Corral, from the Organization of Blind People in Spain. Thank you, Immaculada, for the invitation, and I want to thank the school as well for being able to share our problems and concerns. I was asked to speak here because, first of all, I will say what ONCE is, because there are some people from abroad. ONCE is a corporation of public rights which is tutored by the state and is used to provide service to blind people, disabled people that have visual disabilities. And we have also created a cooperation fund with other disabilities through the ONCE Foundation. And precisely this year has been the 75th anniversary of the organization, and as you know, it has been awarded the Prince of Asturias Prize for Concord. ONCE has a field in which we employ disabled people, and there's an institutional part which provides services with these disabilities or other disabilities that are different. And this is why we have a legal commitment and a social commitment. Both of them are there. And everything that the ONCE does has to do with the affiliates, with the members of the ONCE. I am also a member of the ONCE. I'm a company doctor, and we benefit from all the action programs. As a previous speaker said, in ONCE, for many years now, we have carried out programs for healthcare, specifically aimed to retirement or pre-retirement, and these people involved in the programs are helped with this difficult transition from working to retirement. And along the whole labor life of these people, they receive workshops for blind people and for other people, such as workshops on adapted gymnastics, Pilates, yoga, cultural activities, visits to museums where they have a guide that would show all the features of the museum, sports activities, mountaineering. You know that the ONCE also forms part of the Paralympic Committee in Spain, and we have many Olympic medalists in the ONCE. And this is focused towards a special attention that is devoted to sports activities. I wouldn't like to delve into detail for too long, because I'm sure that discussion will be much more relevant. I will give you a very short personal remark. There's something within the ONCE which is very important. I am a doctor, I'm a worker, but I am also disabled. I have a neurological muscular disease, and for many years I have been fighting against it. I'm going to read you a few verses of a poem that have to do with my response to this situation that I'm suffering. Maybe connecting to what was mentioned earlier. It is an intimate vision that I share with you. Disabled lives. When we hear disability, disease, the first thing we do is to get surprised or amazed. Then we become rebelled against it. Why me? Why am I so unlucky to be disabled? Could I not be lucky in a different manner? And we have to accept it as naturally as possible, but not giving up, but facing a new day as an opportunity and not as fatality. Allow me, from my experience, to say that this is not said by science. This is from the awareness of my condition, that I look for a solution for it. We have to live with disability, but not for disability. The only question that we have to ask every day is, what do we have to do today? It has to be a mantra. Surely it will palliate something. in this world where beauty, apparent beauty, is at its prime, why should I be considered different? Am I the one to change this condition in the first place? Even if we don't have anything to prove, I can't allow myself to be disabled in my life. My life is fully living everything. Thank you very much.
Thank you, Juan Cristobal. Also, for limiting the time you've been speaking. Also, now we will be listening to a series of example on the application of progress, and also an example of best practices from the Municipal Transport Company of Malaga. We will be listening to Maria Jesus. And first, I would like to thank Inmaculada and the School of Public Health for inviting us to participate in this roundtable session. I represent the transport company, the local transport company of Malaga. We're a publicly owned company belonging to the Town Council of Malaga. Some 600 of our workers are bus drivers, and in fact I'm in charge of the risk prevention services, and also I'm a doctor specialized in health and safety at work. So the EASP got in contact with us in order for us to tell you what our experience was because the Progress project. So I'd like to explain to you which have been the facilitating elements, the progress we've made, and with regards to the Progress program in our company, it was made up of a series of phases. First, we worked on the subject of trying to integrate programs or health programs, so they could be all levels of the company could be represented. Also, at the second stage, which meant setting up a team and people responsible for it. Once we had the team in place, we disseminated the project, we did an initial assessment of the situation, and then we planned the activities with a series of intensive sessions, and we went through 8 phases, 8 stages, and I will tell to you the stronger points. At the initial stage, the first contact we had with them, it was through the local coordinator in Andalusia, whose name is Inmaculada. The fact that the project is a European project and that it is coordinated by the Andalusian School for Public Health meant a guarantee. For some time we have been working around this line. We had cooperated with the Regional Ministry of Health in the implementation of a series of programs, for example a physical activity program. We've also worked on a balanced diet, programs for quitting smoking. So we knew that the response of our staff was very good for all these kind of programs. So when at the school we were told to how we could cooperate with the Progress project, we found that the idea was a very interesting one, and the target population we were proposed at the beginning, the 40 years old. We thought that individual actions could be very interesting, and of course we thought that additional tools should be implemented. So the first thing we did was to propose a program to the management staff and the executive board, and they both approved the program, so we ratified the commitment documents. And which are the elements which made the company and the Health and Safety Committee to become involved, not just support the project? One of the elements facilitating the factors influencing the company is that we have got a business management model which is based on a participational model. We work with through a series of committees, for example, a health committee, quality committee, social cohesion committee, another committee with regards to the organizational aspects of the work. So the way in which we work, when we design a project, we all intervene. I think that facilitates the active participation of different persons in the group. We work not just in health monitoring, because sometimes it's difficult for us to be dealing with the company, the executive level to implement programs, but also we do a follow-up of how the programs are actually implemented in the company. So our management plan, our management system approaches health and other aspects within a comprehensive management system. So we manage health measures together with company image, environmental aspects, etc. So that means that health in the company is not taking an isolated, it's not approaching in an isolated manner. And that is quite useful, for example, when we deal with aspects having to do with psychosocial risks. As health and well-being is integrated, it is relatively easy to deal with these problems in the company. For example, dealing with the specific conditions of a specific worker, so that job place is adapted. And these are very important aspects we've got to deal with. It is true that we are an autonomous institution, but such autonomy doesn't mean existing in isolation. Prevention departments should be integrated in management and the running of the company. So in our management system, or our management system is based in continuous improvement. As an objective for continuous improvement, we integrated the main lines of the progress program. We do not just want to work with health in an integrated fashion, but also we want the different companies to be integrated around subjects having to do with security and health. So we in our companies have worked a lot in around the culture of prevention. At training courses, when workers are first hired, workers are informed about psychosocial risks, health and security at work, risk prevention measures, etc. And it is the workers themselves, the ones requesting fora or tools which would promote interpersonal relationships. For example, we set up events around physical activity, nutrition, healthy diet, and for example the social commission sets up sports competitions. We've also got a cycling team, a hiking club. But what I would like to tell you is that the workers themselves are the ones requesting these kind of initiatives. Maybe because of the kind of work they have. They are bus drivers, and usually drivers are isolated from the rest of workers. They are surrounded by people but isolated. They work in isolation, so they have the need to get related to their partners, to their fellow drivers and workers. So they are requesting these kind of activities, and this facilitates our activities. So when we speak to them about let's set up a series of activities, in the end all these initiatives are naturally accepted by the group, because they know that it is good for the company, it's good for the workers, and they, considering the prior experiences, they enjoy a wide acceptance. And once the management board accepted supporting the program, and also the trade union representatives, an executive board was set up for the program. And this team, the health and safety committee members, did not just support the team but also wanted to become members of the team. So the people running the team, which was made up by the chair of the health and safety committee, the social commission, the trade union delegates, etc., all of them wanted to participate. So the program was successful because the different stakeholders in the organization became involved. We have the executive level, social stakeholders, and also technical staff. At the third stage of the program, which meant disseminating the project at the center, the dissemination of the project was done through the personalized delivery of our questionnaire, apart of course from the fact that a series of ads and posters were published. The intermediary level staff, intermediary executive staff, were in charge of communicating all these initiatives. Within the area of psychosocial risks, of course, we have the issue of shifts, and because of the demands of the service, there's a need to put shift in place. So most of the jobs demand that, so at least in our company. So we've got to cope with that. And of course, that means that sometimes it's difficult to involve people. So we had to involve the intermediate executive level so they could hand over the program. So we did personalize following and monitoring of the program and dissemination of information. Later on we did the planning of the intervention, and I want to start there with just that information. With regards to planning of the intervention, I think one of the key factors for its success was that there was quite a degree of flexibility on the part of the managerial staff, the executive staff, because the interactive activity was adapted to the needs of workers, the shifts, the timetables, because that's of course very much needed if you want to set up a calendar. That way we used the same workshop in the morning and in the afternoon, so everyone could participate in it. Of course, we, when setting up the groups, called the workers we have pre-selected. There was an initial selection period, and then all workers who had really included in their questionnaire that they were really interested in participating were the ones called. And that personalized kind of attraction moment, or it's very important. Then we set up the 3 programs, the healthy nutrition, mindfulness, etc. And we got very high marks in terms of interest, participation, etc. And as a conclusion, I believe that for these programs to be feasible in the company, there should be a full support by the company, and of course social stakeholders should support the program. And this means not just supporting, but also providing with the human and economic material resources needed for it. And then there should be someone who would become involved in the project and telling us, well, I want to lead the project, I want to be committed with the project. And of course you've got to facilitate participation to workers, adapting it to the shifts, so also their production rhythms are not affected. I think that's more or less what I had to say. Thank you very much. Right, I was thanking Maria Jesus because She summarized very much what she was going to tell us. Now we will be listening to a colleague from the SAS, from the Andalusian Health Services, Nuria Rialto, who's running the educational units at this service. Good afternoon. I'll try to be brief and limit myself to the main concerns. Also, I'd like to thank IMA, the Andalusian School for Public Health, who are always paving the way on these subjects. Our main challenge in our company, in an institution like the Andalusian Health Service, with 8 hospitals, 28 committees of health and safety, 178 prevention inspectors, and an activity which cannot be stopped, with a staff which is reaching their 50s as an average age, is how do we adapt, how we balance the working condition to people, how we transcend the mere legal fulfillment of conditions. So we've got 36 prevention units, and we always had that had in mind going beyond the lack of harm or damage in terms of prevention, because we thought that in the end we shouldn't be just moved by accidents or lack of diseases or whatever, but rather that in the end we will be having an older team, an older staff, but that we will still have to perform, we will have to continue our activity, and this is something we always thought about in terms of risk prevention. We include, of course, risk assessment, the planning of preventive activities, and we started detecting that the part, our main asset was that prevention structure we had, with more than 80 prevention specialists and about 150 persons working in the area in order to do the actual surveillance of the health of workers. And if you go beyond that and stop just using them in labor risk prevention, you can have an influence in policies and programs in terms of health prevention and healthcare and the prevention of risks. Since 2011 we started to place forward objectives with regards objectives in health, because it is true that among the professionals doing health prevention, one of the main functions is of course the implementation of risk prevention plans, but it is not the main duty of the experts, of the specialists. So we try not to only focus on the health service provision side, but also in terms of the inspectors and monitors. And together with the Regional Ministry of Health, we started training prevention specialists, labor doctors, or doctors specialized in working health, and also of course we wanted to relate that with prevention policies, so when people evolve would be monitored not just in terms of the health conditions or but also that specific cases, specific situation would be discovered in terms of specific programs addressing the needs of specific groups. This didn't start with our own initiative. Hospitals had already put in place specialized programs. For example, the hospital in Córdoba, which had deployed a very intense activity in terms of smoking prevention. Also, there are programs where, for example, in Huelva, in terms of, for example, setting up for citizens, for workers, hiking trails, and all these subject of activities which are not compulsory, to the fact that people enjoy themselves, provide each other social support, enjoy their time, because health promotion at the place of work is still something which is got quite a component of volunteership, but people should not interpret this as an additional working burden, but rather it should be linked in the minds to a series of benefits they will be drawing from it. Also, for example, we promote physical exercise, but enjoyable physical exercise. There's no need for everyone to do the same at the same time. We're making an effort in order to identify which health promotion programs are more advisable, and of course always highlighting the fact that all these activities are volunteer activities. There are annual objectives around that. I would also like to tell you that usually it is not that we have gone ahead the rest. When we see how important this is, and when we analyze how people is working, when we see that there are people who have a bad health from the areas of health prevention, doing this adjustment of the conditions of working, I know that hospitals, districts of primary care, all doctors, nurses, together with prevention specialists, make incredible efforts in terms of adapting their working places. I'm concerned about the fact that that line might be used sometimes for other things, other issues, aspects which are not health prevention, and we should be very serious with regards to that. We must know what are we using all that for. The adaptation of the workplace is one of the mechanisms we have to adapt the work to the person, but at the same time, through health prevention programs, we can go beyond that and think that we do not just have to adapt work, but provide groups with additional programs. In October this year, in 2013, we should go not just for the fulfillment of the prevention law, but also transcend it and see beyond that. And at that structural decree, the General Direction of Professional Diseases is working not just in the management of programs and plans, but also works in the development of programs and plans for a healthy company. And it confirms that these ideas we had at the very beginning, transcending our own obligations because we were going beyond that, were very much focused. In the end, labor health should not be limited to the mere fulfillment of the regulations or the laws, but rather we should be pointing towards socially responsible public sector. That means that our people, we shouldn't just be working in the prevention of accidents, but rather we've got to consider that we've got to guarantee that they enjoy the best conditions possible, that we listen to them, and that should be done in an orderly fashion. Thank you very much. Thank you, Nuria Queralto. And now we're going to listen to the last speaker, Manuel Palencia, who is the coordinator of social well-being programs of the San Miguel Brewing Company. Thank you very much, and on behalf of our General Director, I would like to thank you for having invited us to this conference. I also would like to abide by the time. I just want to tell you who we are. We are a brewing company. We started with Mau Brewing Company, which was just locally based in Madrid. Then we bought San Miguel, then Cervezas Alhambra, then Reina, Anaga in Tenerife, then another group dedicated to coffee and tea, Solón de Cabras, which is spring water, and another spring water bottling company in Jaén. We We've also set up an aloe vera company in Guadalajara. Overall, we have some 2,800 workers between Córdoba, Granada, Burgos, aloe vera, and a new factory which was bought in India in 2010. And our mission in the group is going international. Now we're working in India, in the Philippines, in China. Our main headquarters are in Barcelona and Madrid, and we've also got administrative offices here in Granada. With regards labour risks and labour accident prevention, we've got a comprehensive programs, and these are all the staff. These are all the staff working in this area. 21 people covering all our production centres. On the right hand side, you may see all the areas we're working on, and one of them is called physical well-being and health, which was started in 2001, and I'm the person coordinating it. Our prevention policy is based on three main foundations: the improvement of working conditions, of course, safety, and then prevention or preventive culture and education, which is also a priority. 10,000 education hours were invested in the group as a whole last year, and also the quality and well-being of our staff is our main subject. In the healthy company area, or the concept around the concept of a healthy company, it's a concept we've been dealing with for some time. With regards to what a healthy company would be, first we should be aware of the definition by the WHO, which means promoting health and not just preventing disease. So we're referring to social, psychological and physical well-being, and not just the mere absence of disease. So with that, we should have healthy, safe and happy workers. The main assets any company's got is its staff, and working on prevention and security and well-being and health, and being an environmentally responsible company and working on the personal development of companies, I'm sure we will be attracting talent, and such talent will remain in the company. What is it that we've got in our hands now? Our Tu Salud program will start in 2011. It's an ambitious program. The two logos you see, one of them is from the year 2001, the other one is from past year, and it was started as an ambitious program aiming at developing all conditions. And how it is that we started. This the factory we have in Guadalajara is a very technologically advanced factory. A lot of work is done in training, and we find that our workers are still suffering from the same metabolic syndrome and musculoskeletal syndromes. And that happens because, apart from the working conditions we knew were not that bad, also the lifestyle has a lot to say. And for that, we started the Tu Salud program, For Your Health program. It stems from the surveillance of health. We believe that we've got a good protocol of surveillance with interesting medical checkups programs, and also we work on the prevention of different kinds of cancer: colon cancer, breast cancer, human papilloma. We've started a melanoma prevention campaign. We believe we should become interested on such pathologies.
We carry out rehabilitation in every center, and we have incorporated companies increasingly, and now we have the same possibilities that might be shared amongst the various centers according to the possibilities of the square meters of the sport in particular, etc. However, we always try to carry out health surveillance and recovery. Apart from all this, we see that we have to do something else, and we have preventive programs. Amongst these programs, We have the health surveillance programs. We have a high degree of participation, and we also have the preemptive campaigns. On tobacco, apnea, sleep apnea, etc. This program is called A Tu Salud, on your health. We have several ones in different sizes, and there's one integrated one which includes the most of the elements. We carried out conferences with cardiologists, and we carried out the risk on health surveillance. We have been cooperating with the European Association of Cardiology, and we also recommend the score evaluation process. Last year we had conferences, we had a film to be posted in the internet and to be used for the whole family. I'm sure you know Dr. Kovalan, who was a very famous medalist in Spain. Maria Jose Padial, also the doctor, knows that very well. In the year 2003, we have the back school program. We have 3 days of training. It is based on the Pilates technique. We also have a film. This film has practical exercises which are stretching, prevention of health problems, especially in the back, for children, and the goal is to take it to families. We carried out a healthy food campaign. It was carried out at a national level in 2009, where we do it in several cities. We have nutritionists giving out lessons on nutrition to carry out the evaluations, etc. The guest speakers were the family members, the neighbors, the friends, etc. Municipalities gave us different facilities to carry out these activities. Concerning tobacco, we have a 70% of success of ex-smokers that actually managed to finish this. And finally, we have the workshop on emotion management. We do have experience in 2013 with happiness workshops. It is good to, we have found that it's good to work with a coach working on the handling of emotions. And I will move towards the physical activity program, which is the main program we have, because it's a therapeutic program which is valuable for the rest of the elements, but it's also a prevention program that is quite adequate. It was born in 2003, and we would like to, we wanted to go beyond that line. Sometimes we are told to carry out exercise, and you're told your cholesterol is high, you have to exercise, but they don't tell us how. So in our safe physical activity program, we intend it to be easy and efficient. It is relevant for the knowledge of each worker. We have to take into consideration that in each center we have a situation in which we have the doctor, the nurse, etc. We have a software for exercise prescription, which is easy and which enables us to have an easy prescription of exercise. We carry out the evaluation tests, including force, spine, functionality of the spine, elasticity, balance, spirometry, etc. With all this, we carry out a customized set of elements for this particular worker. And here we can see the design of the application for the exercise. We believe that in 6 months, 24 weeks, it is time enough to evaluate the improvements or the evolution of the physical activity program according to the situation in particular of the worker. We do it in 4 months, in 6 weeks, 6 months, 24 weeks with the same pathology. We may have problems of diabetes, this evaluation of the cholesterol, of the blood pressure, etc. in times that are less than these 24 weeks. In the physical activity price, the whole personnel is trained for exercise. We have technical equipment to carry out this, as you will see in the video that I will show. And in some centers we increase the pace, and hopefully we will be able to have a gym or a workshop which is specialized to capture this big majority of workers that are not performing exercise, that is done either not well or in not a good manner. We have workshops for health in Madrid, in Guadalajara, in Malaga, and the next one will be in Burgos. I was speaking with my colleague, hopefully the next one will be Granada. In the centers where we have health workshops, we try to implement these elements so that we can have aerobics or gym, traditional gym work. We have increasingly younger people. The younger ones want body jump, body pump, but not Pilates, which is very efficient, but they want a more active, more aerobic activity. We have the marching club or the walking club. Those runners are already included, but let's try and find more people that are prone to walking at least. And we are taking them to solidarity runs, such as the marathons and short runs, etc. Next Saturday I will be with our friends in Tenerife. I'm about to finish, yes, I have to finish. And we will take part in the beer running with a happy ending. As you can imagine, there will be a beer at the end. And I finish with something that Imma wanted to show here. In the year 2000, the sports authorities in Spain asked us to carry out a survey, a cost-benefit survey, which is unique in Europe. It is posted in the web, in our web. I do recommend a web on health promotion, which is the one of the government, and it is a full survey that was carried out in Guadalajara, in Madrid. And apart from all the data that you will be able to see there, on the data, on the assessment of this, people carrying out exercise or not carrying out exercise, it was contrasted. The chemical values were much better. There was a decrease in the visits to the doctor. The expense, the cost, the health cost is also lower, and it's good for the company. And this is very relevant. It is true that we were never told that there would be a problem in this fashion, but obviously there was an economic benefit or profit there. 2.9 euros per euro, 2.1 for the state. This could be presented to many companies should present this to their managers. The conclusion of this study, of this survey, was the reduction of absenteeism, of problems in this regard, and also health promotion, health improvement, and of course the society will also benefit from it because of the cut in costs, of the reduction of costs. So in this environment that I have described, with an adequate environment, it is possible to get results. We have carried out an agreement with the regional government to carry out joint projects. Our workers may be happy, safe, and healthy. So now I will show you our protagonists. I have been in the program for 7 months. One of the drawbacks was that people living in Madrid could not exercise here in our area, and the company has given us a few centers to be able to carry out our exercises. I have lost weight, 11 kilos in particular. It is a big sacrifice to come here because you have to be very constant, and you have to come every day, but it's worth it because apart from doing exercise, we are surveyed and controlled and monitored by the doctors, and they take our blood pressure, they care for us. I had an injury when I was playing sports, and I came to this center in the company, and I started a treatment for rehabilitation and sessions of exercise to strengthen the area. We had a test for our back, a strength test, body mass as well, and I have a series of exercises for rehabilitation. I don't have hardly any problems, and I have improved a lot. This is very positive because it helps you feeling better. With an injury of this kind, you can spend 2 months recovering, and in a very short period of time I've been able to come back to a real normal life. Thank you. Thank you, Manuel. We really don't have physical time to finish, but if you need any short comment or question, we do have time for a quick one. Well, we'll have one round of questions, so if anybody would be interested. Anybody else? So you must realize that you are going to ruin your whole roundtable. For Manuel Palencia, what is the role of beer in health? But I would like to stress that maybe you know that our study on beer echoed another study to see whether the practice of consuming beer after exercise was good or not. This was also reflected in a study in the US, and they built the club Beer Runners, and this is what Beer Runners is. What do they do in the end? Because after doing exercise, the normal thing is to have a beer. So is it what they do? What is the case in your specific case? You can imagine what the happy ending is. We all drink beer because we do it as a corporate measure, even if we don't like it. But it is true what you said. This is very interesting as a recovery element for your health. But we are not authorized in these talks to recommend the use of beer from the health perspective. I'm sure that you have more information than I do. Children are also an element, and we have to take that into consideration when we speak about health food. This was not mentioned, but as you know, there are studies that actually support that there's a positive effect in this regard. As interesting as any other product. Over there. Good evening, my name is Pablo Tercedor. I am a professor in the sports science in the Faculty of Sports Science here in the University of Granada. Where there are subjects, training subjects of this kind are in this type of degrees, but we know that other professionals are the ones to have specificity in the training. In this particular case, what we do is a comment or a suggestion. This idea is very good to promote physical activity in the companies, and we should encourage companies to count to include experts in this type of programs. This is a reflection that I would like to carry out, and also a suggestion aiming at a good management, which is already being carried out. Thank you very much. When I arrived in the factory in Guadalajara, I told my boss, I wish we could have a gym here. He had been a football player, a professional football player, so he was concerned with that. We do have a gym now. Our next dream is to have physical therapists in the company and our own personal trainer. This is our dream at the moment, and hopefully it will be fulfilled in the future. All of us in the medical services are either health or labor doctors or similar ones. Some of us have a specialty, but all of us are trained in exercise management, but aimed at health. So we're not doing performance, although we are aware of the fact that a professional in this field would maybe have a better performance, but then hopefully this will be the case in the future. Antonio, you are all professionals, managers of companies and institutions that promote these types of programs in your fields. The question is, what about institutions such as school, etc.? What type of things do you miss? What could we further do in as much as activities, regulation, etc., that could make it easier and more massive the introduction of these types of programs in companies such as yours? Let's make the most of this question to move the or to make it possible for the mic to be used by any other people for the final say. Well, in my particular case, I spoke a lot more about the institutional part, I would say, than the company part. I am a member of a prevention service where I do health surveillance, and I do miss that maybe now I have been surprised by the program on health promotion in the workplace. So far there has been a kind of lack of connection between the labor health services and the public health services, and they seem to move in different directions, so to say. When next week we will celebrate the association, the Malaga Association of Labor Medicine. I was president for some time. When we asked for a meeting with primary care, was the name at the moment, and we asked them about what was then called service on information on public health, and we wanted to take part in this service provision to the worker. And we were asking for these famous P10 documents, and we were told that this was only something that could be done by the health service in Andalusia, and we have to realize that we have to be available, and there were many things that could have been advanced. I'm glad, very much happy to take part in this kind of events, because I think these two things have to be linked. Maybe Nuria, Jesus, Felix, Jose Carlos, anybody? Yes, if you allow me, this lack of connection between public health and labor health, I do confirm it, even in the sense that we are a service. Our unit is one of 6 units, and we are the health prevention service in the Andalusian health service. We have been working in parallel lines, and at a certain stage the service said the main company is our own one, so we should be the first ones to apply this. Many professionals, health doctors or doctors in general, advocate for an interconnection. When Antonio said where, well, I believe it has been valuable in this sense. Have they been the link between public health in the regional health service and the prevention as well? I don't know the reason for that, but when we spoke about it with the regional health service, they also said that we didn't realize that we are the first company we should be devoting time to. There's a health prevention service that could be developed in a way. So I believe that they have a key relevance. This situation should not mean that these cuts should be maintained there. I believe that prevention policy shall be maintained, so that health promotion is maintained as well. Especially the last ones that are found there. In the long run, these are going to be tricky. Well, more or less in the same line, Javier mentioned that we came in touch for the development of this program, and for some time we had no collaboration. Our service has to become involved, and we should cooperate, and responses should be coordinated, and for us it was quite a surprise, and it was very interesting, very positive, and I believe that from now on we can maintain this line of collaboration, and we have to realize that not all companies are big companies. Not all companies are as big as Mau San Miguel with so many resources to have these health programs. Most of the companies are working, but the company does not provide so many resources. So the fact that the regional government takes part in it makes it possible for the company to ask about the cost. This is the first question. How much is it going to be? So the cost in this regard is an economic cost which is not including an additional cost. There's a cost on the part of those who work there. It is more effort, more work, but we have to assume this additional work that is imposed when implementing the programs. But it should not be an additional cost for companies, because otherwise the programs will not take place then. So this would be the final ending remark. I think this is great. The collaboration of the regional government is essential. The ability to carry out this type of programs, and this is important, this is relevant to be able to work together. Jose Carlos? Well, first of all, I would like to congratulate the company, the Grupo Mau San Miguel company from Granada, because they are doing a very good job. And of course the ONCE and the rest of the companies in the panel for these examples that they are providing. We will carry out as many training as required. This will also or will always be relevant for workers. And this will make different institutions and companies to become aware of the needs for this. And now we have to thank the members of the panel, and we want to thank you all for being there, and thank you very much.